Rabies, a fatal but preventable disease. Clinical features: prodromal phase. Tingling and numbness are experienced at the site of bite 2 to 3 days before clinical symptoms appear. Later, low-grade fever, headache and body ache are reported. Clinically, subsequently, patient develops painful spasm of the muscles that control breathing and swallowing, resulting in drooling of saliva, and person cannot swallow and voice may get hoarse. The pupils may get dilated. Tears and perspiration increases. Blood pressure becomes low. Patient develops hydrophobia, fear of water. Photophobia, fear of light. Aerophobia, fear of breeze. Later, as the disease progresses, patient gets agitated, combative and destructive. Shows mental confusion, becomes sensitive to touch, noise and light, gets extremely thirsty but unable to drink because of painful spasms in the throat, develops dehydration, loss of muscle tone and listlessness is seen in majority, and eventually death occurs in 3 to 5 days due to respiratory paralysis or cardiac arrest. According to a recent recommendation of World Health Organization 2007, there are 3 categories of exposure. Category 1 exposure. 1. Touching of animals. 2. Feeding of animals. 3. Licks on intact skin. Recommended treatment. In these types of exposures, since there is no risk of developing the disease, no treatment is recommended. However, if they have pets, they can be advised pre-exposure vaccination. Category 2 exposure. Minor scratches, abrasions with superficial nibbling of skin not associated with bleeding. Recommended treatment. As this is an exposure carrying minor risks, local treatment of wounds and a course of anti-rabies vaccine are advised. Category 3 exposure. 1. Single or multiple wounds with breach in the skin and bleeding. 2. Licks on broken skin and mucous membranes. 3. Bites from bats and wild animals. Recommended treatment. As this is an exposure carrying severe risk, local treatment of wounds, administration of rabies immunoglobulin and a complete course of anti-rabies vaccine are advised. Wound management. The animal bite victims should first wash the bite wound and rabies exposed parts thoroughly under running tap water and using detergent or soap for at least 10 minutes. This removes and inactivates the virus present in the wound to a great extent. This is a very important first aid measure that should not be neglected by animal bite victims. Then they have to gently wipe the wound and can apply any household antiseptic like Dettol, Savlon, povidone iodine or spirit.